شوفي ستارت بعد ما ستارت.
هي بلش. لأنها بتقدر تفتح تشوف المحاضرة.
يلا تعي سوي بوينتر وين؟ لو ما في بوينتر هم يهم. لا لا افتحي هون يطلع.
هي
بوينتر يطلع. ما
بدك نعمل عرض صح؟
ما ايه مش هذا البوينتر،
بس ثواني.
هذا البوينتر.
أكيد كثير ثواني عشان يبين صغير.
ما يهم هياته هون كبير معلش. مراح البوينتر شايفه؟
هلا بدي اسالك. فيكتوريا
بعدين عندي ورا ما خلص.
هو دوام الجروب الثاني، هو شكل المحاضرة الجنبية.
السلام عليكم وصباح الخير. وهلا انتم كل واحد على السيت تبعه للنمبر ولا شو؟ إذا تعالوا للأمام بليز. ولهذا أوكي. تعالوا للأمام بليز. يلا الجميع. أوكي. Today we are going to continue. تعالوا للأمام please. أول column. أول column. لا. Okay. تعالوا للأمام please. Okay. Today we are going to continue our lectures about the biological exposure or biological hazard during work, and we already mentioned one example which was anthrax. I am sure أنه أنتم ما بيكم حدا قراها. Today another example is Q fever. Q fever also known as query fever. هلا بعدين نعرف ليش سموه query. That's why the Q جاية من query. It's a bacterial infection طبعا caused by bacteria Coxella burnotii. It affects a human and another animal, so it is a zoonotic disease. You know it. The most common animal reservoir, of course, for this disease, we have cattle, sheep, goats, and other domestic mammals, just like cat and dog. A human typically gets infection as a result from inhalation of the contaminated dust. Okay. In another word, there is a spore in the dust. So the human inhalated it from contaminated dust of infected animal طبعا, and also from contact with the milk, urine, fecal material, placenta, or any other birth product of the infected animal. Of course, there is another mode of transmission that is by ingestion. We will discuss it later on. Rarely, the man will affected by tick, okay, by tick, or it is a tick-borne disease. Humans are vulnerable to Q fever. One spore will infect them, not like that of anthrax that the 10 to 20,000 spore will infect man, but here one spore infected man. So man, in another word, man, I mean human being طبعا, are vulnerable to Q fever. Okay. And infection can result from even few organisms or even one spore. It's very vulnerable disease. Okay, we said it is from contamination of the product or animal, whether urine, milk, and also the highest amount, just now I mentioned, from the birth product, the highest amount of bacteria found in the birth products of the animal. It means the placenta and amniotic fluid, okay? So that's why the farmer and veterinarian people are at a high risk of this disease. People who work with this animal, of course, they are at a highest risk of this disease. Actually, that disease causes a mild, very mild sign and symptom like a flu. And even there is asymptomatic cases. We will see what's the importance of this asymptomatic later on. Okay, for mild symptoms similar to the flu, it will clear within a few weeks without treatment. And this is also very important. And however, people may have no symptom, asymptomatic. But in rare cases, it will change into a very serious case. It will change into chronic, or there is a reinfection or reoccurrence of the disease. And this chronic disease and reinfection, it will occur in certain people. We will see also who are those people are going to be reinfected or to be changed into a chronic, although it's very mild, 50% only, 5%. Okay, it's serious form disease developed into infection. Man is persist if the infection persists for more 6 months or more. In this case, we call it infection. Okay, so a more serious form, it can develop into reoccurrence of infection. Just now I see chronic, and this will occur about whom? About people who have a valve disease, heart valve disease, and also with a low weak immunity, so they will be at a high risk of occurrence of chronic, and even pregnant women also be at a high risk of chronic, okay, or reoccurrence of a disease. The animal transmitted the bacteria, of course, as we mentioned just now, via urine, fecal material, fluid from the birth product, and also milk and so on. So when they pass it in the yard, it will dry inside the area, and that's why it converted into dust contaminated. It will become dust and become for us inhalation. Okay? The mode of transmission. Contaminated dust and can float in the air, definitely. Human get fever when they breathe or inspire the contaminated dust. In a rare case, just now I mentioned, also it occurred by unpasteurized milk. So we have inhalation, we have contact, we have gastrointestinal, okay, and also by tick, very rare. For mode of transmission, can contaminated dust can get fever drinking unpasteurized milk or from infected, okay. It is not transmitted from man to man. Never transmitted, just like anthrax. It's spore. Okay. Sign and symptom, we will go very fast. Of incubation period 2 to 3 weeks. Symptom just now we said just like a flu. Okay, so from what it's differ from one person to the other, depend on the severity of the disease, and all its flu-like symptoms. Most common manifestation is flu-like. There is fever, malaise, profuse perspiration, severe headache, and so on. Nausea, vomiting, and diarrhea. About half the infected person exhibit no symptoms. So 50% no symptoms. The other could be mild, and only very, very rare, it's about 5% will be as chronic. We will see. About half of the infected person, there is no symptom. during the course of the disease, it can be progressed to atypical pneumonia. So there is a very serious complication of this disease. Atypical pneumonia, which will be life-threatening of the person. Another, will occur 4 to 5 days. Another complication, hepatitis. And this could be asymptomatic, no jaundice, but there is changes in the liver function test. Become symptomatic with the malaise fever later on. Transaminase value and the other liver function test will be elevated. Jaundice is uncommon. Just now we said. Another complication is retinal vasculitis, affected. And it is very rare. The chronic form of Q fever, it will lead to endocarditis. So you can see there is a very serious complication, or in another word, it is life-threatening complication for the person. Although one spore will cause all these things. Endocarditis, which occur months or decade following the infection. Maybe 10 سنوات, maybe 20 سنة. That's why it is important to ask about the job of the person. Okay? Not the current, but also about the previous job. However, with the appropriate treatment, it's life-threatening, of course, fatal, this one, and by treatment, the fatality rate, case fatality rate, will decrease up to 10%, but it is a fatal if untreated. Okay, who are at risk? I am sure now we know who are, because already we mentioned it through the lecture. So, since it is infect cattle, sheep, and goat, and other animal, so people who are at farmer, and veterinarian, people working around sheep, working dairy industry, maybe contaminated milk, infected, people working at meat processing, and researcher, definitely, researcher laboratory, and in addition, anybody live close to this factory, or close to the yard of the sheep. Okay. So living close to the farm, because it is by dust inhalation. Yes. That's why it is very important. So this is another question when you ask a patient, you have to ask where his residency and what's around him or her in order to give a complete diagnosis. Of course, diagnosis of Q fever, of course, by antibody, based on the symptom alone, it's not enough. Just now we said. So we are going to do antibody and then diagnosis by blood antibody and another by the PCR or another things. Actually, the antibody is not enough, particularly in acute form. They found that if you do antibody even 7 times, the result will be negative. So it will be still negative first 7 to 10 days of the sickness. So it's not a diagnosis. You have to wait. Frequently appear negative. While in chronic, yes, in chronic the antibody is present. In a chronic infection, serological allow detection of chronic infection by high level of antibody. Another diagnostic, chest X-ray, and then transaminase or liver function, but even there is so many cases that cause elevation of transaminase and aspartase transaminase. Hepatitis liver biopsy, of course, if there is a liver enlargement and so on, and molecular detection. Culture is difficult to be done, but we depend on the molecular. What are the complications? Although already we mention it, okay? Sometimes Q fever persists for a long time, change into chronic. It will change into chronic form, and it may lead to serious complication. Already we mentioned, we say endocarditis, the heart, to the liver, to the brain even. And high risk group develop Q fever, chronic Q fever. Who are they? Just now we mentioned the person who have valvular disease, blood vessel abnormality, weak immune system, and pregnancy. So those persons are at a high risk to develop the chronic form of Q fever or recurrence of Q fever. That's why for pregnant, you remember, we have to change her job when she gets pregnant. Okay. According to the CDC, chronic Q fever occurs less than 5%, just now mentioned. So 50% asymptomatic. Okay, 5% or less than 5 will change into chronic form. The most common and serious complication of Q fever, okay, heart condition, bacterial endocarditis, which is a fatal unless it is treated. Other serious condition is less common, just we mentioned pneumonia and other lung disease. When it occurs in pregnant, there is miscarriage, abortion, miscarriage, stillbirth. You know what do you mean by stillbirth, akid, and low birth weight or premature birth. So all these complications occur during pregnancy if she got Q fever, particularly if it occurs as a chronic Q fever. Other, already we mentioned, hepatitis and meningitis, we mentioned it before. Regarding the epidemiology, of course, already we mentioned that Q fever cause agent, Coxella burnotii. It is pathogenic or agent, is found everywhere بالعالم. Everywhere it is present except New Zealand. Except in New Zealand, ولو أدهم يربون بقرة بس there is no, because we will see why. The bacteria is extremely susceptible and virulent. Sustainable, it means stay live on the outside the body. Sustainable, it means living outside the body. And it is virulent, as we mentioned, just one spore will give infection. Okay. A single organism is able to cause infection. One spore is enough or one. Common source of infection, of course, we said inhalation, contact with the contaminated milk and meat and such, and particularly the birth product, because it heavily occurs in a high quantity in a birth product of animal. Tick can transmit it, but as we mentioned, it's very, very rare. There is no transferring or no transmission, man-to-man transmission. Okay. From epidemiological point of view, some study found that it is more among male than female. Why? From occupation point of view, لأنهم يتعاملون مع okay, so that's why it's higher. Already we mentioned who are at risk: veterinary person, stockyard worker, farmer, sheep, shearers, animal transport, laboratory worker, and all those who are treating animal and or animal product. As we mentioned, Q fever at the first, it had been discovered in 1935. Okay. They found the sign and symptom, but they don't know the causative agent. That's why they call it query fever. They don't know. That from that came the Q fever. Okay. Q query fever, and then they know it. Treatment, of course, antibiotic, it's very effective antibiotic, or so many antibiotic, tetracycline, chloramphenicol, and so on. A treatment of the cases, duration as well as the dose, depending on the stage of the disease or on the severity of the disease. أحسن. Mild infection usually resolved without treatment or within a few weeks without any treatment. But it is very important. We will see why it's important later. In more severe cases, we give antibiotic, doxycycline, it is antibiotic choice. Okay, taking immediately. Okay, if you suspect that this case is Q fever, so you have to treat it immediately, even without appearance of the laboratory. Okay. If he had high fever or another mild symptom, so you have to treat it immediately. Begin it immediately if the fever is suspected, if a Q fever is suspected, even before laboratory result. We have to treat it 2 to 3 weeks. If the symptoms decrease within or disappear within 72 hours, within 3 days, it means this is Q fever. If it doesn't disappear, it means this case is not a Q fever. So, first 3 days or within 72 hours, okay, the symptom, including fever, should be subside. In this case, if not subside, it means this case is not a Q fever, but you have to treat it as long as you are suspecting as because it's very important. Chronic infection, in the acute, we said we treated 2 to 3 weeks. Coming to chronic infection, also antibiotic for 18 months or even 4 years, we will see. So we have to treat it for 18 months. A chronic Q fever is more difficult to treat it and can require up to 4 years. He should stay on antibiotic for up to 4 years. After treatment, as we mentioned, there is the case fatality rate will be decreased. As you remember, it become about 10%. Okay, antibiotic is very effective, particularly in endocarditis and other diseases. Let's نمشي شوية. There is, what do we call it, Q fever vaccine. This is very important. Please take care of it. This is licensed in Australia in 1989. Okay, has shown to be highly effective in preventing the Q fever against, طبعا, in a human being. Protection is affected by Q vaccine. So that's why, since administration of this vaccine, there is a decrease in number of the Q fever all over the world, but still there is. The vaccine, as we mentioned, is made in Australia. The vaccine is given as a single injection, subcutaneous single injection. 0.5 subcutaneous injection given in the upper arm. Okay, by assuming that blood tests have been done before giving injection, before giving the vaccine. Okay, because it's very important. Assuming that the blood and skin test is negative. Otherwise, it will kill the patient. So, protective immunity lasts for many years, maybe 5, 4, 10 years. Revaccination, there is no need, most of them. But what do we have? We have what do we call pre-vaccination test. We said that skin and the blood test should be negative. Let us see what's this pre-vaccination test. What's pre-vaccination screening or test? Okay. First, to avoid risk of severe reaction. Because if he had antibody, he will get severe reaction. The vaccine should only be given to those who have not been in contact with the animal. That's why full detail of history detail should be taken. So it should be given, not given to those who had history. Or identify pre-existing immunity. So أنا ما بعرف أنا عايشة هذا أو هذا فار. Maybe I am ill. So before giving me the vaccine, they should do a test. We will see what this test is. Okay. Identify pre-existing immunity. They should identify my immunity before they giving me the vaccine, because vaccinating people who already have an immunity can result in a severe local reaction, and it may threaten his life. So what are these pre-vaccinated screening or tests? They are three. Definitely, complete history should be taken. Interviewing about Q fever infection. Complete history. Then blood tests should be checked the immunity, whether there is antibody or not. And skin test also to check the immunity. So these are three tests that should be done before giving the vaccine. It's possible to have been in contact with the Q fever bacteria, and just now we said there is asymptomatic, or the symptoms just like flu, and it will cure without any treatment. So I don't know, I have Q fever. That's why testing the immunity is very, very important. Annual screening is typically recommended. This is done in Australia, particularly those who are working with the animal. Animal screening, done recommended every year. Skin reactions such as redness are common 3 إلى 4 days after skin test. However, it will disappear within 7 days if there is antibody. So it is very important. What should be considered after vaccine? So this is pre-vaccine. There is another thing after vaccine. If they vaccinated me, okay, they have to give me 15 days rest. I should not go back to my job. Okay. So 15 days after vaccination before starting work again. So we have pre-vaccine, we have post-vaccine. Keep the worker record. This is one. Keep the worker record is very, very important. Remember, complete record of the person, and this record should be transferred whenever the job had been changed. The patient, the person. Keep the worker record in a safe place as an important, particularly if the worker changes his job from area to area. In 2001, Australia introduced a national Q fever vaccine. They have this law, okay, the program for people working at a risk. Vaccinated or previously exposed person may have their state record on the Australian Q fever registration. كل واحد اللي كان be vaccinated or he had been infected, طبعا بعد أن يسووا له test, they put his or her record in a particular place at Australian Q fever registration, which may be a condition of employment in the meat process, particularly those اللي يسوون meat processing. The vaccine is long-lasting immunity. We said it exceeds 5 years. There is possible side effect as any other vaccine, it doesn't matter. Up to 50% of those vaccinated will have local redness, tenderness, and so on, swelling, and it will disappear. Around 10% of the vaccinated will have side effect, will include mild influenza-like symptoms like تبع الكورونا, such as headache, fever, chills, and so on. Serious side effect is very, very, very rare. Who should be vaccinated? Of course, a vaccine is strongly recommended for people who are they, who work at a high-risk occupation. Already we mentioned it. Martin, we mentioned it. People whose work in contact with the high-risk animal or animal product. People can also be infected outside the work. بيتي من الفار. So outside the work, مش بالضروري. Okay, especially in who's live or visit a rural area. So all these people should be vaccinated, but again and again, before we vaccinated him or her, we have to do pre-vaccine test or pre-vaccine screen. High-risk group for Q fever, if they are not vaccinated, should take the following prevention. People properly disinfected and decontaminated the area, proper disposal of the birth material or animal product, washing hands, quarantine infected animal, milk pasteurization, test animal routinely. Just now we said every year they should test it annually for infection, restrict the airflow from barnyard and animal holding. Put it aside. Preliminary result suggests vaccination of animal may be a method of control. That's all. Published trial proved that use of registered phase vaccine on infected farm is a tool of a major interest in managing and preventing animal early or late abortion, repeat breeding, and decrease milk. All these, if we vaccinated the animal, these things will be occur too. And thank you very much. أي سؤال لكم؟ آسفة. أي سؤال؟